Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?
Well, hello, everybody. Welcome to the Think Small podcast. I'm your host, Denise Steinbring, and today I want to start with a number. 45 miles southeast of Columbia, South Carolina, in a county of 105,000 people, there is a healthcare organization that has 300 employees, 40 medical providers, 12 facilities, including 4 school-based clinics, a mobile unit, and over 77,000 patient encounters a year. It has a pharmacy, behavioral health, dental, OBGYN, infectious disease, and full primary care. It won 4 Best of Sumter awards in 2025, and it has been led by the same CEO since 2004. My guest today is that CEO, and she also started as a nurse. Annie Brown is the CEO of Tandem Health, South Carolina, a federally qualified health center serving all of Sumter County, South Carolina. She's been at the helm for 21 consecutive years, starting at the Bedside as a registered nurse, got her master's degree in health administration while already running the organization, and has grown it from a small clinic with 27 employees and 1 location into one of the most comprehensive community health systems in the Midlands of South Carolina. Annie, it's such a pleasure to have you here. Thank you for joining the Think Small podcast.
Yes, ma'am. Thank you for having me. It's a great opportunity to tell our story, and I'm very excited to be able to share.
Can you maybe explain to our listening audience what is a federally qualified health center? How is that different than what people might be used to?
Okay, well, a federally qualified health center is a private, nonprofit, board-governed, outpatient primary care center. I don't like to use the word clinic to describe FQHCs because we really are comprehensive health centers. Yes, the difference is that we receive federal support through a grant from HRSA's Bureau of Primary Health Care, and that helps offset our cost for being the safety net provider in Sumter County, for taking care of people regardless of whether they have insurance or not, or maybe they have insurance, but they have high deductibles. We have the ability to place patients on a sliding fee scale so that they don't have to have a large down payment just to see the doctor when they walk in, that they aren't turned around because they don't have insurance. It's really an impressive system, and I'm very passionate about it.
Yes, and clearly you've been there a long time. So before we get into the organization more, I really wanted our listeners to understand you, because your path here is not the typical healthcare administrator path with a finance degree or an operations track or a corner office, right? You came from the clinical side, from the bedside, and you come from a family of small business owners. So tell us the backstory.
Well, my clinical background definitely shaped the way I lead. Nursing teaches you to constantly assess, prioritize, communicate, and adapt in real time. At the bedside, you learn very quickly that small decisions can have very large consequences, and that translates directly into executive leadership. Growing up in a family of entrepreneurs and small business owners, I developed an appreciation very early on for both people and operational realities. That combination has influenced the way that I approach leadership today. In healthcare, you cannot separate mission from execution. Compassion matters deeply, but sustainability matters too. If an organization is not operationally sound, you cannot continue serving the community long term. And over the course, actually, of my 23 and counting years as the CEO at Tandem Health, I was the director of nursing prior to becoming the CEO. We've grown from 1 location, as you mentioned, to 12. Those 4 school-based health centers have been really exciting steps forward for us. We hope to be able to expand those programs throughout the entire Sumter School District. Our mobile unit is out, reaching out, and we're using that in several outlying, very rural parts of our county. Tandem Health is the FQHC for Sumter County. We have 1 county in the state that we serve out of the 46 in South Carolina. Of those 27 employees who started with me so long ago, I have a handful of them that are still with me. I had one of those girls graduate, or ladies now. She was a girl when I hired her, graduated our Chamber of Commerce Leadership Sumter program last night. And she was able to say that she had been there just as long as I had been there. Everybody gave her a round of applause. She's just been able to grow and develop, and I've helped her, along the way. The 300 members we have now of, hashtag Team Tandem, that's kind of how we promote ourselves. It's a multidisciplinary, highly educated, very passionate group of people, from our patient account reps at the front desk to our specialists. That kind of growth only happens when you combine mission-driven leadership with operational discipline. And so in calendar year 24, just that calendar year, Tandem Health generated more than $62 million in economic impact and supported 381 jobs across the communities that we serve.
Wow.
A few of my non-negotiables obviously are accountability, transparency for sure, because while we do receive that federal grant, we also receive reimbursement through Medicaid and Medicare, and those are taxpayer dollars. So it is, as long as I am at the helm of this organization, it will be completely transparent. As a small business in our community, it belongs to everyone. It's taxpayer money. I am very aware of that, and very keen on making sure that we know exactly, I know where every dollar is spent. We have high quality standards, the financial stewardship that comes along with that transparency and accountability is very significant, and making decisions that protect the patient experience. The nurse in me always, at the end of the day, it is about the patient.
Yeah.
And it's my job and my responsibility to make sure that they're protected, but also to make sure that the organization is stable long term.
Yeah. And patient access is such an unmet need, in the nation right now, right? And so you're
Right.
doing some amazing things there in rural parts of South Carolina, right? And with you at the helm as the patient advocate, that makes sure that the patients always get the very best, even though it has nothing to do with their ability to pay, right?
Correct.
And
That
you
is
talked,
absolutely correct.
yeah, you talked to me earlier about your board. So tell me a little bit more about your board makeup and why that's such a great sounding board for you.
It's amazing. I don't know that all my colleagues across the country would agree. I don't really know. I can only speak for myself, but it's one of my absolute favorite parts of the entire federally qualified health center program. By federal regulation, my board of directors, they are responsible, obviously, for setting policy and governance, and they have the fiduciary responsibility, and they are responsible directly for me as the CEO, and then I'm responsible for everything that falls under me. The majority of the people that I sit around a board table with or a board committee table with every single month have to be patient consumer users of the health center services. Who better to sit around the table with than the person who is walking in every day, whether they are the parent of a child who's receiving pediatric services, whether they are a patient themselves, whether they're a behavioral health patient or a dental patient or an OBGYN patient. They are that they're the undercover boss for me, so to speak. They know that they are observing from a different lens in their board role. And they also realize the importance of bringing what they've experienced back to the boardroom table so that we can talk through it from a global organizational kind of viewpoint, so that we can make those changes, and we can, it allows my executive leadership team and I to really research what the event was, how it was negative, how it could be better, what needs to happen as a result of that. And then, they are able to come back through at their next visit and hopefully experience that change. And I think it's an amazing concept. Right now, Tandem Health's board is 14 members strong, and 11 of those 14 are patients of the health center.
Wow.
And it's amazing. The board should represent the populations that are served by the health center.
Mhm.
The majority of patients that we serve at Tandem Health are women, and they are minority women. And that is who represents the greatest majority of our board. The remaining members, if I'm not able, we are not able to capture, the industries throughout our community. The non-consumer members really are supposed to help fill in those gaps. But currently, we have several active duty Shaw Air Force Base board members, and we have attorneys, and we have higher education with the University of South Carolina Sumter. We have a variety of different viewpoints, different backgrounds, and it really makes for an interesting dynamic.
I bet. Is there a piece of gold that a board member shared with you that you might not have otherwise known? Can you
Um,
think of an example?
I can think of an example, and I know that we're making a difference, in someone's life every day. But when you really hear how you make the difference, and you wouldn't have heard it otherwise. So I've had a board member in the past who had a friend that had the company he was working for was closing down, and he was otherwise healthy but had a liver condition and needed to see the specialist twice a year. As long as he took this one medicine, he was healthy as he could be. But when his Cobra ran out, about 45 days before it did, he just happened to ask the pharmacy, the local retail pharmacy, how much that medicine was going to cost him per month. And this has been probably 10 or 15 years ago, Denise. The response that he received was $1,800.
Wow.
And it was one pill once a day. And so my board member was able to say, hey, if you are a primary care user of Tandem Health, then the physicians can refer you back to your specialist, and you'll get the prescription from your specialist, bring it back to the health center, and you'd be able to fill that prescription using the health center's pharmacy services, which obviously is 340B drug pricing. And so we were able to help him get that cost from $1,800 a month down to about $480 a month.
Oh,
And he cried. He didn't want to leave his private primary care physician. This is a small community we live in, and I understood that, and I knew who that physician was, and I was able to meet with him, to meet with him as well as my pharmacy director, and explain, if you just go talk to your physician, I know he's been your physician for 15 years, but explain to him why you need to transfer your care, and I feel confident that he will understand. He wants you to be healthy. He wants you to have this medicine. And if this is the way that you need to be able to go about doing it, then he's going to be very supportive of that. So that's a great example. The man would have never known about our pharmacy or our health center or anything that we did really, unless it was for that board member.
Yeah, that's amazing. And maybe for people who don't understand what 340B pricing is, can you explain that a little bit?
Um, I will give you the 30,000 foot description of 340B, but 340B is a drug discount program that was actually created for community health centers many, many, many years ago. And it allows ultimately community health centers to purchase pharmaceuticals at a discounted rate. And so because of that, we're able then to offer pharmaceuticals to our patients. You have to be a patient of the community health center. But we're able to offer those prescriptions similar to the example I just gave you from many moons ago, at reduced rates. And so, you can come to the doctor every day if your diabetes has you feeling unwell. You can show up every day and be assessed and given a prescription. And if you're unable to fill that prescription, you're going to be back the next day. Or even really what happens, at least in our community, is we have a lot of people that used our emergency room for primary care services because they're not exactly aware of the resources that are here. And so that drives up healthcare costs for everyone. And so when you are able to say to the patient, would you like this to be filled here today so you can pick it up on your way out, and you give them an example of what the price is going to be and they're able to afford it, that just improves health outcomes like beyond our wildest imagination. We have an incredible clinical pharmacy team, and we have 2 pharmacy site locations, and it just really closes that gap, because if you aren't following up to make sure patients receive prescriptions, then you don't know if they're taking them or not, and then you're expecting them to have a better outcome without any kind of oversight and coordination of care between point A and point B. And so the 340B drug pricing program, it is essential to community health centers. Health centers across the country represent about 3% of the total 340B volume throughout the program. But with these cuts that are kind of looming over all of us with manufacturers, it could jeopardize just healthcare services and community health centers everywhere, not just in Sumter, because we use the 340B savings. We like to call them savings. That's what we reinvest back into the health centers to expand services, improve access, hire more providers, kind of branch out into specialty services. And so, when that cost savings piece becomes threatened, then you're looking at access to care being threatened. And, it's definitely not rocket science to think about the fact that preventive care, primary care, having a primary care medical home and a provider that knows you and a team of people that work with that provider, that is so much less expensive than a costly emergency room visit.
Exactly. Well, that's a nice segue to our next section, because I think this is an interesting facet of your business as well. So your revenue comes from federal grants, Medicaid, Medicare reimbursements, private including, right, and patients paying on a sliding fee scale, as you mentioned. But right now, there are serious conversations in Washington about cutting Medicaid and community health center funding, as we just said, right? So you've run this organization for 21 years through multiple federal budget cycles, payment reform waves, and a global pandemic. So what do you know about building an organization that can survive funding instability that most business owners who have a much simpler revenue model have never had to learn?
Well, I think one thing that I have learned is sustainable organizations are never built by one person. And so while I love being the CEO at Tandem Health, I know that I'm a strong leader simply as a result of the people who work for me. Leaders who know how to build strong teams, empower talented people, and just create alignment around that shared vision. That's how you're successful. That's your foundation. I have not built Tandem Health by myself. Our growth and stability have only been possible because I have an incredibly committed executive leadership team. I have very strong department leaders in place, and my entire staff across our organization cares deeply both about our mission and our operational excellence. I personally do an orientation and training with new employees. Sometimes it's once a month, sometimes it's once every other month. It just depends kind of how our hiring transitions, and how we have experiencing turnover. But I take that time to explain what a community health center is, community health center, federally qualified health center, because my experience over my tenure has just been, when you don't understand it, you can't buy into it. And then when you understand that as a taxpayer, it belongs to you and you create that ownership over it, people step up and they become accountable. And so the biggest lesson I've probably learned when it comes to funding is that, I think any nonprofit or any organization, especially in a healthcare setting, that's receiving federal funding is vulnerable. I don't ever remember a time where we didn't feel vulnerable about one thing or another. But when organizations rely too heavily on any one single funding source, they set themselves up for lots of not just vulnerability, but stress and sleepless nights, if I have to say so myself. In the healthcare world, it's constantly evolving. There have always been reimbursement changes. There have always been workforce pressures and regulatory shifts and economic uncertainty. So diversification and disciplined growth, those are key elements when it comes to sustaining an organization, especially like Tandem Health. We've intentionally built multiple revenue streams. So we do have the federal grant, and we love having the federal grant. But I have, in my 20 years, tried to maintain that revenue stream less than 10% of my total revenue. I don't ever want to be too heavily dependent on it. There are lots of other wonderful things that come along with your FQHC status, like 340B drug pricing, and the way that health centers are paid with Medicaid and Medicare are different than the private sector or even hospital-owned practices. So there are lots of other ways that the health center is able to save money because we are expected to take care of anyone who walks in our door. We take private insurance. We have community partnerships in place. And there is intentional strategic reinvestment. And 340B is one example of how we're able to continuously grow and develop. It allows us to stretch our resources further, reinvest those savings directly back into patient care. We expand services, technology, staffing, and access points. Simple, like our mobile health unit most recently is a great example. So we focus heavily on long-term infrastructure instead of short-term reaction. And over time, that approach has allowed us to grow from one site to 12 and also continue to expand access and strengthen operational stability. We served over 19,000 patients in 24. When we first started, I think we had 6,000 patients. Majority of those uninsured and self-pay. And so it's been important not only to reinvest back into the system, but to do it in a way that allows the organization to be attractive to everyone. So we have just as many privately insured patients, and that's a huge misconception about health centers is we're not just for lower income populations, we're not just for Medicaid and Medicare. We'll take care of you regardless, whether you have insurance or whether you don't have insurance. The sliding fee scale is amazing, I think, because we can actually place individuals that have insurance with insurance coverage with large deductibles. We can place them on that same sliding fee scale, and they can pay according to their income based on the federal poverty level until they're able to reach those deductibles and can actually use their insurance. Having an insurance card in your back pocket doesn't mean necessarily that you have coverage. Right. And I think a lot of times people have a misconception about that. But for me, sustainability is about stewardship. And I've mentioned that before, but I'll say it again. Strong mission work still requires strong business strategy, financial discipline, and the foresight to make strategic adjustments before circumstances demand that you do. I mean, you've got to plan, you've got to constantly reassess. One thing we've done in the last 2 years that I think has been really helpful for us because of all the financial uncertainty and all the changes that are kind of looming, as all we can do and oftentimes is just respond. But I moved us from annual budgeting to quarterly budgeting, and we're doing rolling quarterly budgets, and it has really been helpful because things change overnight. And it's just really helped us maintain our business lines and maintain our financial integrity very, very closely, and that's critical.
Yeah. Well, gosh, you're giving us so many great tips and tricks that I think are news, for the first time to people. And I love your intentionality about your diversification, right? Because you can pull on different levers when you get into trouble, and there's an unexpected headwind when you've got that diversity. that
Right.
a lot of companies that are single product companies, right, either need to grow their product lines or grow their customer segments or have
Mhm.
some other risk mitigation plan so
Right.
that, they can survive those headwinds. It's fascinating.
Absolutely.
You touched on something about community health, right? I think when most people hear that word, they think about charity, right? These are people who
Mhm.
are unable to pay. And we've talked about what happens when you don't have a primary care provider and you end up in the ER. But when, you know, maybe you could share with what every CEO and their business owner in Sumter County care about. Why do they care about what happens within Tandem Health? And what is it costing their business right now that they don't know is being caused by a healthcare access problem?
We have a lot of industry locally here, and there would be nothing more terrifying, right, than an entire shift that's on a line getting injured at the same time, or not showing up for work because they're in the hospital with blood sugar issues or hypertension. We are in the South, and there are lots of comorbidities, um, obesity, hypertension, diabetes. Mental health is one of those ongoing, everywhere is affected by that. But I think it's important, for our local community and every community really, to know that there is a place available for their employees, that we want to form those partnerships to be able to, again, not only just see a patient who has diabetes, but make sure that that patient who has been seen can get their insulin, can get their glucometer, can get their test strips, can get whatever they need, that they can be, we have a diabetes self-management and education support group. We have a nutritionist. We have all of the resources, and we're expected to address every single need of a patient, every social determinant of health, whether they have food insecurity or whether they have transportation. It's just important. It's to the workforce. And one thing I love about Sumter, I was born and reared here, and we are a small business community. We have many boutiques. We have butcher shops. We have bakeries. We have restaurants. I mean, it's just an amazing small business community. And when you have the mindset in your community that you want to keep your business local, you think, and no harm, no offense to Amazon. I love Amazon. When I need it quickly, I use it. But if I can go to the local party shop to buy balloons and they're at a decent price, then, I know, my staff knows, our event planners know, keep that local. That's how we keep our community alive. And so it all works together. We're here to keep the workforce healthy, to keep our children healthy, to keep everyone as healthy as they're willing to be. There is accountability for the patient in their own health. We can't do it for you, but we can give you the tools. We can equip you with everything that you need, and we can keep you healthy, and we can keep you at work. And, driving down employer sponsored benefits plans is a huge goal of ours, because even the health center is dealing with those issues. I mean, it is, something we look at often. What's our employer spend? And, the sicker your workforce is, or the more unmanaged they are, then the less, that puts you in a position where you're seeing less productivity and less return. And so, keeping people healthy is really important. In 25, our and this really just speaks to kind of that cost effectiveness, the high quality, and just the balance. But I can say with certainty that our annual cost per patient in 2025 was $1,760.91.
Wow, that is
I know
amazing.
that. Yeah, it's amazing for the year. Now,
Yes.
the average patient is going to come in 3 times, but may only come once or may come 10. But, you know, you I would be hard pressed to understand how anyone could walk over the threshold of a hospital's emergency room and leave and it be less than $1,760.91. And that would be one visit for an acute or urgent reason, hopefully, but oftentimes it's primary care related.
Right.
And so being able to capture that and pull it into the health center and help that patient in any way that we can, it sincerely, realistically, and every day drives down the local cost of healthcare in our community, which helps everybody.
Yeah, those are some amazing statistics. Sounds like you've solved the healthcare crisis. Now we need to just roll it out across the country.
Well, you say that and we laugh, but community health centers in our country are the largest primary care network, period. The end. And one thing that when I learned about this podcast that I was so excited about doing is because I feel like we tell our same story to the same people. We tell the FQHC story. We tell the legislators, we locally, state level, federal level, and how do we really get this story out to people who don't really know anything about it? Because when we've got to start telling our story differently, and every small business does. Yes. You can't do things the way you've always done them and then expect to get a different result.
Yeah.
It just does not work that way.
It's like the best kept secret, right? I mean, you've got so many resources for employers that they likely may not know about.
Yeah.
But that kind of takes me to my last question here. You've shared so much wisdom with us, but for a founder or business leader who's listening, who's building something right now in their community, maybe a nonprofit, maybe a business that serves people who are underestimated by the market, what's the one thing that you know now that you wish someone had told you when you started?
Oh my goodness. I think how important establishing a sound team, surrounding yourself with subject matter experts and then trusting them to do their job. I'm never going to pretend to know everything about 340B or pharmacy services in community health centers, but I have an amazing chief pharmacy officer. I have a VP of business development. He's my relationship guy. He's my in the community, in every site, every day, connecting the dots, helping share how it changes lives and how it can affect businesses. So not trying to do everything yourself because you think that's your responsibility. And maybe you can't hire a large team. Maybe you hire 1 or 2 or 3 people, and you hire those people in your personal areas of weakness, the ones that you may be a sound financial guy or woman, right? But you might, like Annie, not know the pharmacy business. And pharmacy is not nursing, and nursing is not medicine, and they all have to coexist. It's interdisciplinary. But when it comes down to running the business aspects of that pharmacy and understanding all of the regulation changes, I lean heavily on my chief pharmacy officer. And that's how we're successful. I think, and my dad would tell you this, he was a grocer, and I made the mistake of saying I was bored one summer and I was 10 and he put me to work bagging groceries, and my dad's a micromanager. He about put himself in the grave because he felt like he had to be in every store. He had to know everything that was going on. And, I watched that from a very young age. And so I guess the next nugget of wisdom or tidbit would be, trust the people that you hire and allow them to do their job. When you're micromanaging someone, especially at a top level, executive level, department level, who am I to go and tell one of my nursing directors 20 years later how they should be handling efficient patient workflows when I haven't been in that position for 20 years? I only know what I knew, right? And so when I think a lot of times when executives and owners almost get in the way of their people, right, it can stagnate the growth of the business, the growth of the organization. And so I think, making sure that you have the right people around you is key.
Yeah. Gosh, well, this has been a remarkable conversation. The things I took away were understand 340B pricing and what it could do for you and your employees. diversify your portfolio so that you can face headwinds, build a great team around you, and then trust your team to execute, right?
Absolutely.
For our listeners who want to learn more about Tandem Health or connect with you, where should they go?
Well, www.tandemhealthsc.org, and you'll be able to connect with me that way, learn all about our services. My email address, abrown@tandemhealthsc.org, and you can feel free to reach out to me anytime if you have questions. One thing I do want to mention before we get off, and I know we're short on time, we do economic value and impact reports every year based on our federal reporting. And, when I can say to someone, hey, my total budget, in 2024 was $32 million. And we took $32 million and we provided services to over 19,000 patients, and we did 70,000 plus visits, right? And people are like, well, that's amazing. That's impressive. And I go, yeah, but can I also tell you that we had a $62 million economic impact that same year?
Wow.
Our economic impact was $30 million more than our annual complete operational budget. And I can show that, just Tandem contributed an estimated $28 million in savings to the overall healthcare system because we make primary and preventive care accessible.
That's amazing.
And, it demonstrates that multiplier effect community health centers have, and it matters to employers because healthier communities create stronger local economies.
Yeah. Well, you're definitely in your sweet spot. I can hear the passion in your voice. And to our Think Small listeners, if today's conversation changed how you think about the cost of healthcare access in your community, or reminded you that the most complex operations in America are often run by people who started at the very beginning of the work itself, share this podcast with somebody who needs to hear it. It'll be dropping soon. We'll see you next time. Thanks so much, Annie, for being on the podcast.
Thank you, Denise. Enjoyed it.
Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?